Good morning, everyone. The employment section calls me its president, so not the chair. Either way, I'm pleased to present this seminar today and introduce the two speakers who are both members of the employment section board. Maggie Grover and Anjuli Cargain. Maggie has been practicing employment law for over 30 years. She does all aspects of employment law. She litigates, she trains, she consults, and if that's not enough, she also mediates as a mediator involved in alternative dispute resolution. In addition to that, she's a super lawyer and a super athlete, having, so she says, I didn't see this, but she says she's bicycled from Canada down to California, 1,000 miles in 17 days. So I'm impressed. She's also written extensively, spoken extensively, all on employment matters. Anjuli Cargain, despite the fact that she works on the employer side of employment law, is the president-elect of the employment section. She's an associate at Duane, litigates all aspects of employment law, a super lawyer, has written extensively and spoken extensively concerning any issue you want to think of. And if you're an employer, I guess give her a call if you have a problem. She also does workplace training. She didn't tell me anything about her athletic ability, but I know she likes wine because she attended our virtual wine tasting and was an avid participant. So with that, preventing pandemic pandemonium, take it away, Maggie and Anjuli.
Good morning, everyone. Thank you for the introduction, David, and welcome to today's presentation. So, as you may well know by now, during the COVID pandemic, businesses have had to react very quickly to a variety of laws, local orders, and other restrictions on their businesses, and also accommodate their workforce at the same time. So it's been an overwhelming set of regulations and a complicated past few months. So the goal for our presentation today is to touch upon some of the key guidance that is relevant to employers as they reopen their workplaces and continue to do business. There are, as I mentioned, a number of different laws. Some of these laws are federal laws that apply to all employers. There are state laws here in California, but there are also a number of local city and county ordinances that have been enacted since March to address COVID-19 concerns. So we're going to talk about those today. In addition, the World Health Organization and the Centers for Disease Control, federal and worldwide organizations, have promulgated guidance as well. So we'll talk about that. So here on the first slide, we point out some of the concerns that employers have to balance. The health of the workforce is important in balancing that with the continuing operations. So what does the health of the workforce mean? We're going to talk about how to address employees in the workplace who are undergoing concerns about themselves in COVID-19, and also the treatment and care for others in their family due to COVID-19. In addition, employees may be affected because of circumstances like school shutdowns that prevent them from going to the workplace. So we'll talk about that. In addition, we'll talk about some of the industry guidance that's applicable to certain types of employers as they decide to continue their operations.
And
go ahead.
I'd like to add to this is these regulations are changing constantly. For example, yesterday during his daily briefing, Governor Newsom announced that he's got another set of guidance that's coming out tomorrow. So we can't talk about what actually is going to come out tomorrow, but know that there are going to be changes, and there are going to be weekly changes as different organizations, different entities come up with new regulations, guidance, orders, whatever they do, and that counties move in and out of the guidance at the state level.
Right, and a lot of the information that, as Maggie said, is changing, but a good resource is California's COVID-19 website, which is covid19.ca.gov. And on that website, you'll see some prompts for different types of guidance, and you can kind of click through that and get the most up-to-date information. So we encourage you to check with the sources directly, before making any decisions about these types of issues, because it is an ever-changing landscape. And so I wanted to just touch upon the guidance from the CDC, the Centers for Disease Control, before we move on. It's obviously a huge organization, but they have promulgated guidance about face masks and protective equipment applicable to individuals, but also employees who are working in your businesses. The state of California has its own face mask order. It's a statewide order. And several counties within the state have promulgated more restrictive face mask and protective equipment standards. So that's an area, that's kind of one of the major areas for employers to think about in terms of reopening is, maintaining the appropriate protective equipment and providing that to employees. Some businesses are even allowed to turn away customers who are not wearing appropriate face masks. In addition, the CDC, as well as, the CDC has and the state have issued guidance on travel quarantine. And this is really important because many of your businesses may require your employees to travel. And traveling within the state is generally not an issue, but traveling out of state or out of the country could present problems when your workforce returns back to California. California doesn't have any enforceable mandated travel quarantine requirement, but there is guidance saying that certain individuals must stay at home and observe quarantine standards when they return back. Now, there's lots of exceptions, and generally essential workers or those traveling on essential business are exempt from those requirements, but there's definitely best practices that should be followed. So I just want to touch upon those two points before we move on. So our next slide goes into safety at work. Maggie, do you want to jump in here?
Did you want me to talk a bit about the OSHA guidance at this point? So OSHA,
sure, yeah, let's do that.
OSHA has tried to adapt its regulations and guidance for respiratory illnesses to the COVID-19 pandemic, and is reporting that those same standards for all respiratory illnesses are going to apply in respiratory risks. So they're talking about masks, they're talking about the obligation of the employer to provide protective equipment, and they're talking about cleaning of spaces and distancing through the OSHA guidance. One of the things that a lot of employers don't think about is the need to provide appropriate respiratory protection for exposure to cleansing agents. So if you're using bleach or alcohol-based or some other very vigorous cleaner, you may need to make sure that whoever's doing the cleaning is providing it all of the appropriate masks. And it might be a different mask for a cleansing agent than it is to prevent transmission of the COVID virus. Another thing that many employers believe is required by the OSHA guidance, but I don't think is required, is the opportunity to provide customers who are coming into the work environment with masks free of charge. I think it's a great idea. I don't think it's legally mandated. The other issue, the other two issues relating to OSHA right now are the need to report illnesses and deaths. So if you reasonably believe that an employee has contracted COVID in the work environment, you have an obligation to report that to OSHA. And OSHA is now stepping up and beginning to open up investigations again, and they're reporting a higher number of complaints about failure to provide protective equipment, transmission of disease. I think possibly because people are just afraid and they want to make sure that they have the maximum level of protection if they have to come back into the work environment.
So to address these concerns, it's a best practice to develop, if you haven't done so already, workplace safety protocols. So that would involve conducting a hazard and risk assessment, coming up with a preparedness and response plan, a plan to detect, potential sources of work-related COVID-19 transmissions. For example, factory workers or businesses where the workforce is required to have close contact. That's going to be an area of concern and potential COVID-19 transmission. So it's important to look at these issues, do an assessment, and come up with a plan that controls for mitigation of COVID-19 transmissions. And then you've got to implement the program. So that could involve training in delivering best practices in a way that employees can access and understand them.
And the state's website does have some model policies that companies can look at and have to adapt to their particular work environment and the risks that are inherent in their work environment. The other thing that the state requires is that employees be trained before they come back into the work environment. So you can't just invite everybody back and say, hey, we're going to train the first day. You have to offer some kind of training to them. I think it's a great idea to reinforce it in their first day back and in your weekly safety meetings if you have those kinds of things.
Right. So another aspect of safety is screening for illnesses, and this is a hot topic. You might have read about it, about different practices and protocols that employers are implementing. But there's a variety of ways that employers can screen for illnesses, and that these obviously have to be balanced with privacy concerns and other concerns that employees may have if they're required to undergo testing or screening. So I just wanted to touch upon some best practices for considering the types of screening that may be applicable during COVID-19. One of those is designating a specific individual who's authorized to screen employees. So rather than having, a range of managers be vested with the ability to screen, it might be better to designate just one person who's fully up to speed with the appropriate protocols and to be a touch point for the business and employees if there are issues regarding illness screening. You've got to provide appropriate training to any individuals that will be screening. They need to have the appropriate personal protective equipment that's in line with the CDC and state guidance. And as I mentioned, implementing the screening procedures should address the privacy issues of employees and any compensation, such as wage and hour issues that could come up if they're waiting for screening. So if they're at the workplace, but they're standing in line and waiting to be screened, they probably have to be paid for that time. And then the final point is, well, what happens if during the screening symptoms are detected or illness is discovered? You've got to have a plan in place to respond to those employees, customers, or visitors who fall into that bucket.
And because the screening is actually a health screen, it's governed by the Americans with Disabilities Act and the California constitutional right of privacy. So one thing that I have seen employers do, which I think is a mistake, is have a log, and the person who is at the door checking temperatures with hopefully one of the no-touch thermometers, then immediately writes down the temperature recorded and the fact that the individual, the employee, has said, oh, I don't have any conditions. And that log is then left lying on a desk for anybody to look at. I think that that creates privacy concerns. When you turn somebody away, that may create privacy concerns because you're now announcing to whoever else is standing in line that they didn't pass the screening test. Anjuli, what do you think is the best practice on that?
Well, I think first of all, there's not a requirement to do screening on site. So there are options for self-screening. That may work in some workforces, it may not work with others. So yeah, privacy is a big issue, and it could be an area where lawsuits start to develop if individuals feel like their privacy, their health, their confidentiality with respect to their health is being compromised. So again, I think the way to protect against that is to designate as few people as possible to be privy to that information, and then training that individual on how to keep it private and the need to keep it private, and then also, developing best practices around that in terms of storing information and doing that potentially in some sort of confidential system, electronic system, rather than having multiple documents floating around. So that's an area that's developing, but that's my thought on that point.
Yeah, and I also think that there are employees who will voice their concerns about the privacy of their health information if they are screened on their way into work. And for the most part, what I have seen is when you explain to them that it's for their own protection as well as for the protection of everybody else, that they are willing to go through it without a lot of beef. But the other option, which sounds harsh, is to say, we require screening, you're going to have to go through the screening, but you don't have to come to work. And you will be on unpaid leave of absence, or you may even be subject to a layoff, which is really not ideal. But I also think that it would be legal if you want to impose an across-the-board screening requirement. The last point on this slide is unique industry requirements. Again, depending on what your industry is, you're going to have to look for those. And they may be different city to city, county to county.
Right.
I know that there are a lot of requirements around reopening childcare centers and the number of kids and the pods, and keeping the children and the adults in the same pod. There are lots of requirements around any health facility, any seniors facility. And some of these things are things that small businesses are pushing back on because it makes it more expensive to operate. But there are solid scientifically based reasons for most of the things. And does the employer business have to increase its prices to cover that? May well be, but they can't just wink and nod and pretend they're complying with the industry requirements, because I think that would be significant evidence in any lawsuit that arose because of COVID exposure if the employer was just sidestepping.
Right. Yeah, and again, it varies industry to industry, but also county to county. And there's some great guidance for certain counties, and other counties there's not so much guidance. So the recommendation is to
employers that operate in multiple counties, I always recommend that they take the most restrictive, most protective to the employee and just apply it across the board, because it's better to do that than to try to figure out what they can do in San Francisco versus what they can do in Walnut Creek and what they can do in Sacramento.
Right. Yeah, it's a great tip. So we talked about providing guidance for management on how to, communicate with employees regarding COVID-19 and especially screening for illnesses. Along those same lines, guidance should be provided to management about upholding social distancing requirements and preventing close contact. Although your workplace may not be a factory, it could be just a typical office setting, there's quite a bit of close contact that's possible in that scenario as well. So it's important to not only inform your management about what the standards are, but also to uphold those standards and enforce them. Because as Maggie kind of pointed to already, it's great to have policies, but if the policies are not implemented and employees are not taking them seriously, then there's a real risk of lawsuits based on violations of those standards.
Management is going to set the tone for the office. And for example, in private offices, if no one else is likely to come in, you don't have to keep a face mask on all the time. But if people are likely to come in, you should have a face mask on all the time. And I know a lot of executives think, oh, I'm on the phone all the time, I need to be able to breathe, whatever their objection to a face mask is, makes them sidestep that requirement. I urge people to make sure that they're setting the tone and setting the policy and following it. Look for alternate ways of dealing with something. If you're on the phone all the time, get a headset that fits under your face mask, for example.
Yeah, great tip. I want to circle back to the travel quarantine issue that I talked about at the beginning of our talk. For workforces where employees are traveling out of state, it's important to consider not only what California's requirements are, but also the requirements of other states. For example, although California does not have an enforceable travel quarantine requirement, meaning that you don't have to quarantine for 14 days once you return or arrive in California, many states, but states like New York, New Jersey, Rhode Island, Pennsylvania, Connecticut have really strict laws. Actually, Pennsylvania's laws is voluntary, but it's expected that people comply, meaning that if your employees go to one of those states, they may have to stay there and be quarantined, for the duration of their trip, or 14 days. So again, there are lots of exceptions for essential workers and essential travel, but it's important to consider not only the employee's resident state, which is probably California, but also the requirements of where they're going to.
And if they're returning from someplace, there may be a quarantine requirement. For example, if they've been early in the pandemic when Europe had extremely high rates of exposure and virus transmission, and people who had no symptoms but were coming back from Europe were asked to self-quarantine for 14 days. So look at that as well, and that would trigger potential leave protection. I wanted to talk a little bit about high-risk employees in the workplace and employees who don't want to come to work. That all of the guidance, or not all, but a lot of the guidance says if they can do remote work, they should be permitted to do remote work. That has a disproportionate impact on people who are lower wage earners. It is usually the executives and management level that are more flexible in their ability to do remote work. And so you got a high risk situation that could be, it could have a discriminatory impact. And that's something that employers need to look at when they are talking about really who can do remote work. If you have an employee who is has a prior condition like a lung damage or a history of cancer, or is going through cancer treatment now, and so they are at a higher risk of exposure or a higher risk of long-term damage if they get COVID-19. Those employees, the DOL urges you to be flexible with them and try to find a way for them to do remote work or be more isolated in the work environment. However, if they have a job and they refuse to work, the standards allow the employer to say, well, you don't have any leave. Leave doesn't apply simply because you're uncomfortable coming into the work environment. We ready for the next slide?
Right. Yeah. And yes,
Okay.
we can move on. And I don't want to jump around too much, but I just wanted to highlight that the Department of Labor issued a field assistance bulletin yesterday about remote workers. Now, the focus of that bulletin was wage and hour issues, but I just want to point that out since we're talking about Department of Labor guidance as it pertains to remote workers. So check that out when you have some time.
So one of the very first changes in the law that came out was the Families First Coronavirus Response Act, which is a federal law. And it amends the FMLA. And so a lot of small employers were thinking, well, you know, the FMLA does not apply to me because I'm not large enough, but it specifically applies to small employers, employers with 500 or fewer, well, not 500, 499 or fewer employees. And it provides two different kinds of leave for those small employers. The first kind of leave is when the employee themselves is sick, or they have been quarantined, or they are needed to take care of somebody who is quarantined. And that's a 2-week leave. And it is a paid leave. The leave is capped at $551 per day, or their full pay. And that leave has to be given before any other leave. So if the employee has vacation time, if the employee has state mandated sick leave, if the employee has any other kind of leave, then that FFCRA leave comes first. Fortunately for these small employers that have to give this leave, there is a tax advantage where they can recoup the money that they have spent. They have to keep really good records to show what the condition was that triggered the leave and the wages that they paid out to support their claim of the tax credit. And the second type of leave is for caring for a child whose childcare or school has been disrupted and the parent needs to take the time off. Interestingly, what I am seeing now is a lot of, I would like some intermittent leave. And for the most part, FMLA leave can be given intermittently. But for this purpose, the employer does not have to provide intermittent leave. Generally, if the employer can provide intermittent leave so that the parent can stay home for the hours that the child is in school and then perform their work, or the employer can provide flexible schedules, I urge them to do that. One, you've got an employee who knows their job, and having someone learn their job on a remote basis or a part-time basis is a challenge. Two, you've got an employee who's got multiple stressors. If they're at home with their family more time than they usually spend, they're trying to learn 7th grade math so they can help their child understand it, or in some cases, 3rd grade science. Families that have the parents are not native English speakers, may be learning English along with their children. So there are lots of stressors that are going on that are abnormal. And the Department of Labor, as I mentioned, says work with flexibility to the maximum extent possible. So I encourage employers to be really creative in thinking about how they can accommodate their employees' needs to be with their families, to support their families, and still do their jobs. And that may mean part-time work and part-time leave. This leave, the 12 weeks of leave that's available to the parent or parent equivalent is paid, but it's paid at a reduced rate. So the cap is, I'm gonna forget that actual number, but it's 2/3 of the regular wage, or I think it's $200 a day. So those are two federal rights that came into being. There are lots of regulations around it. They were not well written because they were written in a hurry. And the regulations are in some places, I think, inconsistent.
Yeah, and one thing to keep in mind with the part-time employees is that they're not entitled to the full amount, like the 80 hours of leave that are provided full-time. And so there's a calculation that is set forth under the federal law and then also under the local laws that we're going to talk about in a minute.
So did you want to talk about state?
Yeah, sure. So in your materials today, you'll see an article, that summarizes the California state and local leave laws, as well as the emergency local ordinances that have been enacted. Generally, these are known as paid sick leave laws. However, some of the existing laws apply to COVID-19 related circumstances. So in addition to the FFCRA, the federal law, and FEMLA, employers may be required to pay paid sick and family leave benefits under either the state or local ordinances, as well as their own leave policies, right? So those have to be considered as well. So starting with the existing state, the pre-COVID-19 laws, in California, certain counties, such as San Diego, have existing ordinances that provide for leave benefits to be paid for circumstances like a public emergency. So San Diego has not come up with any COVID-19 related local law, but its existing paid sick leave law could presumably pertain to an employee who needs leave during COVID-19 for a school closure. So it's important to take a look at what the existing paid sick leave laws are to see if any might apply. Now, 3 cities in California promulgated paid sick leave ordinances in response to the FFCRA. So Maggie told you about the 500 or 499 employee maximum that the FFCRA applies to. So for employers who have 500 or more employees, the FFCRA doesn't apply. But the cities of San Francisco, Los Angeles, and San Jose enacted essentially equivalent paid leave laws for large employers, so employers with 500 or more employees. Those laws came into effect in early April, and some of them have expired. The San Francisco law, called the San Francisco Public Health Emergency Leave Ordinance, was extended until August 16th. There may be legislation, the city may pass a law to extend that. That's very possible. So under these local ordinances, employers have been required to provide equivalent leave benefits, either 80 hours for full-time employees or a part-time employee equivalent based on their hours worked over a certain period of time. although they may be large employers. Each one of these city ordinances has different exemptions. So some apply to all employees in the workforce, some apply to only certain employees. Some of these ordinances apply to temporary or contract employees, some do not. So it's important to take a look at those and see if leave can or should have been provided to employees under those ordinances. Now, typically the way these laws are drafted, if the employer's policy has already allotted leave and that leave has been taken by the employee, the employers don't have to give extra leave beyond the 80 hours or the part-time equivalent. Statewide, for employees working in the food industry, so it's anyone from food farming and agriculture all the way up to fast food establishments and restaurants, there's a special paid leave law that came up to provide FFCRA equivalent leave to those workers. So important to take a look at that if that pertains to the industry. I think that's all I wanted to talk about with the state and local leave laws. You'll see that. Sure.
So workers' comp leave is going to apply if the employee has a work-related illness or injury, and if the employee contracts coronavirus in the work environment. That is protected time off under the California workers' compensation system. So far, what workers' compensation insurers are doing, from what I have heard talking to them, is that they are pretty much giving workers' comp benefits to employees who are in situations with uniquely high risk, like first responders, the hospitals, the police officers who are in the thick of things, the firefighters, anybody who does have to deal with COVID patients on a regular basis. But they are denying, at least at first cut, the claims of people that come down with COVID who have no higher risk in the work environment than they would walking around town. And that's the initial cut. However, if an employee comes up with some solid evidence that they were exposed at the workplace, then workers' comp would have to trigger, and the employer would have to provide that time off. For example, I am aware of one manufacturing facility that was, they had 3 workers who came down with COVID-19 all at the same time. One of them died, and then 4 other people who were in that same work environment were diagnosed with COVID-19 within 2 weeks. And those 4 other people do have a workers' comp claim that I think is reasonably valid. It is obviously difficult to track, but I think they are developing better tracking tools. I don't know that we're using them yet, but for now, if they can demonstrate, if the worker can demonstrate some realistic risk of exposure, it should be a workers' comp leave, and you should treat it as such. And that would mean that it would be paid through workers' comp. I think they still would get, if the employer has to provide the family's first coronavirus leave, they would get that first before they went on to the lower paid workers' comp system. And one thing I forgot to mention about the FFCRA is that it sunsets at the end of this year. And this is not something right now that is going to be another 12 weeks in 2021 if we are seeing another wave and still unable to have realistic treatments or a realistic vaccine by then. But will Congress extend it if we are still in pandemic mode? I think that we will see some kind of extension, but right now it ends at the end of this year. So moving on to the Americans with Disabilities claim. There are employees who are saying, and employee counsel who are saying that If an employee has a fear of COVID, that is can be viewed as a disability that should be accommodated. And that if they are afraid to come into the work environment because of their fear of COVID, then you have to at least engage in a reasonable, discussion, good faith interactive discussion of a reasonable accommodation. So far, I have not seen any regulation or guidance specifically from any federal or state agency saying that this really is an appropriate type of accommodation to provide. I think that if they talked about being high risk themselves, someone who has lung damage, going through cancer treatment, or any of the other, an employee in their 60s or 70s who has higher risk, that's not by itself a disability if it doesn't interfere with a major life activity at all. The standard for what is a disability, however, is fairly low. Lung damage actually probably is going to be a disability, but simply being old, there are cases that say that's not a disability by itself. And the lung damage doesn't actually prevent them from doing their job. So what is the reasonable accommodation is always going to be the question the employer is asking. I would still look at it from the employer's perspective to see if there's some flexibility that you can provide. Again, it's a morale issue. It's an issue of having employees who understand your work environment and understand your work rules and what you're doing. And they are a valuable asset to particularly small employers that this is going to put a greater burden on. And you're going to have to balance the burdens. If you're an employer that's gone through a reduction in force and you've got someone who wants to remain at home and be on unpaid leave for the duration of the pandemic, and you've already reduced your workforce, that may be a very valid way of accommodating them. Okay, you're going on unpaid leave instead of having to put someone through a furlough or lay off another employee. The same is true, I think, of ADA leave to protect a high-risk family member. Employees just don't want to be in the work environment potentially bringing home the COVID virus. I think that those employees, the discussion goes a little differently because it's the family member, and you can talk about ways that they can protect themselves at work and protect the family member. There are plenty of first responders, people who are dealing with treating COVID patients regularly, who have adopted procedures and go home to their families and are not spreading the virus within their families. So there are ways that this can be done, but it's part of the interactive discussion. And the interactive discussion, I think, in this environment, you can put some responsibility on the employee themselves. Would you agree or disagree with that, Anjuli?
Oh, I agree with that.
Okay. Yay. Yeah. Let's move on to the slide. So I generally see one or two sort of out there employee relationships in a year. I have seen, I think, 8 so far since March this year. And much of it is because we are all under stress. The employers are under stress. They're concerned about their business being viable. They're concerned about whether they are able to keep their employees employed. They are concerned about financial issues, and they are concerned, many of the managers and owners of small businesses are dealing with the same thing that everybody else is, homeschooling and fears of contracting the virus. They may be a sandwich generation person and they're unable to visit their elder parent or a dear one near to them because of the virus. So those are all real stressors for the employees. They've got the homeschooling, they've got the job loss. People that are working at home may be spending 24 hours a day with their spouse. And that's a difference in the relationship. People, I keep reading, you're either going to come out of this with a really solid relationship or no relationship. There's not going to be a lot of middle ground, because it does change the relationship and puts a lot of strain on it. So for the employer, for managers, I urge them to take the long view, think about coming out of this tunnel, assume that we are going to come out of the tunnel, but also look at what they can provide to their employees. Do they have I'm going to blank on the term, a healthcare plan that allows their employees to get confidential counseling on a short-term basis? If so, make sure they offer that. Do they have a health plan that offers their employees the ability to get financial counseling on a short-term basis? Talk about that. Be open with their employees about what their plans are and their concerns are. When they go through a reduction in force, I think they can acknowledge to employees that we don't know, we're doing the best we can, we're interested in hearing your ideas for how we go forward. For the employee perspective, urge them to be flexible, urge them to talk about their concerns and come forward. And really, dialogue is probably the best answer that employers and employees have. Keep in mind from the employer side that you're going to have to keep this dialogue confidential between people that need to know about it and the employee, but do engage in it, be willing to look for flexibility. Listen, if the employee has ideas that are being rejected out of hand, they're going to feel much more stress than if the ideas are at least being given consideration and being accepted in an open and honest manner.
And so I just want to jump in here. Some employers may wish to conduct a voluntary return to work type survey. As Maggie just touched upon, it's important to be very careful if you decide to implement one of these surveys, because confidential information will inevitably be collected and stored and accessible. But in order to address a lot of these stressors that Maggie described in a productive and useful way, it's important to know what's going on with your workforce. So you may, if you decide to do a voluntary survey, you may want to inquire about specifically about childcare needs, health concerns, status of COVID-19 diagnosis or symptoms, whether the employee commutes, where they commute from, and what that looks like, so that you can understand, what the issues are before you, develop the protocols to address them. But again, you've got to be very careful implementing such type of a survey, and you should consult with counsel before you do that.
And I remember the term that I was looking for, which is an employee assistance plan, which is an EAP program, and it is often a part of a group healthcare package. You can also acquire an EAP program independently, and so that's something that employers might want to be looking at right now. So, wage and hour implications. Do you want to take the lead on this?
Sure. Yeah. Are we planning to take a quick break, David, or should we go right into the next topic?
It's up to you. If you want to take a break, take a break.
One thing that we didn't say at the outset is we are going to have questions, and maybe if any questions have come in so far, David, if you want to read those, and that
would be good.
Yeah, that might be it might be a good time to.
No open questions.
Oh my!
So you
okay.
are answering everyone's
crystal clear
question. Folks, come on.
So then let's
questions.
Maggie, unless you disagree, let's go on then to wage and hour issues.
That sounds good.
Okay, so we've touched upon already the fact that, remote work is the new normal. And we've told you about the DOL guidance that came out yesterday on wage and hour issues under federal law pertaining to remote workers. Now, our firm wrote an article on that. So if you'd like a copy of that, please contact me. I think it's too late to get it into the materials for today. But we did put together a very nice piece summarizing the DOL's field assistance bulletin applicable to remote workers. To the extent that employers are going to allow teleworking arrangements, which we recommend they do, employers need to ensure compliance with all of the wage and hour laws. This includes the federal laws and state laws respecting meal periods, rest periods, overtime pay requirements, and making sure that they're tracking remote workers appropriately to mitigate risk in that area. Along the same lines, it's inevitable that as workers return to work, there's going to be changes in compensation and schedule. Maybe not so much changes in compensation for your exempt employees, but there's likely going to be schedule changes. And some of those changes may be driven by the employee's circumstance. Some of those changes may be driven by the business's circumstances and caused by financial difficulties that the business has had to undergo. So anytime a decision is driven by the employer in terms of reducing compensation or reducing the workforce or changing hours, it's important to consider, first of all, are these changes being made in compliance with federal wage and hour laws? Are they being done in compliance with the federal WARN Act and also the California WARN Act, which is more restrictive in several ways? And also, are they being done in a non-discriminatory way to prevent the result of having older people be on the list of people who are being laid off, or people of color, or people who share other types of protected characteristics? So if an employer needs or desires to reduce their workforce, they've got to consider all of those issues. Employers also have to look at whether any of their members of their workforce who they are seeking to make changes to involve collective bargaining agreements. So if you've got collectively bargained employees, that may restrict an employer's ability to implement changes. Employers also have to look at their own company policies with respect to changes in compensation or hours of work, and provide appropriate communications to those employees. So some of those communications that are given to employees are governed by federal laws like WARN or the California WARN Act. But employees do, in most circumstances, need to be provided with written notice of their compensation changes or their schedule changes within the laws. So there's also the circumstance that many employers are facing where they don't want to lay off workers, but they want to furlough, or they have furloughed a portion of their workforce. California law treats furloughs differently if they are short-term versus long-term, meaning they last, I think it's more than 30 days. So furlough, under California law, furloughs lasting longer than 30 days may be considered a layoff triggering either the California WARN or the federal WARN Act. So it's important to look at that closely. A temporary furlough may be okay, but a longer furlough may have broader implications. In addition to that, there's the intersection of unemployment insurance laws and furloughs and layoffs. So employees who are furloughed may likely make inquiries about whether or not they're eligible to collect unemployment insurance benefits. Unemployment insurance is governed by California law in the EDD, but there are also there's a federal counterpart that emerged during COVID called the CARES Act. I'm sure you've heard about it. It's a very complicated law, but that for a certain period of time provided a supplement. And I'm not certain if the CARES Act has been extended beyond its end of July sunset. Maggie, do you know?
I think they're still fighting about it. I think that's one of
the that's
going back and forth.
That was my take on it too.
Yeah.
Right. And so it's a very active space right now. There's a lot of legislation that's being considered about with respect to extensions of the CARES Act. But that was for a period of time a biweekly supplement that got tacked on to individuals who were eligible for any amount of unemployment under state law. So even if they were eligible for $1 of unemployment under state law, they would get the full federal supplement during COVID-19.
So I wanted to add. Sorry.
Yeah, sorry, it's per week. I think I said biweekly. The federal supplement was a weekly supplement.
I wanted to add a couple of things on the previous slide. One of the things that some employers are doing is saying, we have work for you, but it's not full-time work. And so we're going to cut people down to 3 days a week or 4 days a week or 2.5 days a week so that because we don't want to lay people off and we don't have the amount of work. So we're just going to cut your hours and your pay. And the problem with doing that for exempt employees is that an exempt employee is required to have the same salary week in and week out without regard to the amount of work they perform. So simply saying you senior manager are going to work 4 days a week because that's all we need you, and we're going to pay you for 4 days a week, so we're going to pay you 80% of your salary, that kind of matching is going to potentially convert them from an exempt employee to a non-exempt employee, so that if they're working 10 hours in a day, they're going to be entitled to overtime wages. Having it be, you can reduce their salary up front. You can say, we're reducing everybody across the board. All our exempt employees, we're going to reduce to 75% wages, but tying it to the amount of work that they are doing is a potential problem, and you need to look out for that. And then a little follow-up to what Anjuli said about the Warren and Cal-Warren Acts. When the pandemic started, there were headlines about the Cal-Warren Act being an exemption to the Cal-Warren Act when the employer was going through a layoff reduction in force related to the pandemic. And there is an exemption in the federal Warren Act that can be read as having a situation caused by an act of God that gives you a right to skip it. What employers who only read the headlines did not realize is that there are a lot of boxes that you need to tick. You still need to give a warning as soon as you are able to do so, and to give as much warning to be able to satisfy that exemption to the Cal-Warren Act. So people that did it already, that's water under the bridge. They probably violated it. The employees may not know that they violated it, but in the future, if you have to do a reduction in force, make sure that you, even if you can't give 60 days warning, if you fall under the Cal-Warren Act, give as much as you possibly can.
Yeah, that's a good suggestion. And in I think it's also important to touch upon communication, appropriate ways and best practices to communicate with employees who are being furloughed. For Warren, there are specific requirements. that have to be in the employees' the notice to the employees. But for furloughed employees, it's really up to the employer's discretion in terms of all of the content that they put in those letters. In communicating with furloughed employees, it's a best practice to do that in writing and do it in a way that explains, even in broad terms, the circumstances of the layoff, and, you know, as it pertains to the particular business. In addition, if it's applicable, the employer could state that they are continuing to review, you know, or that is an ongoing process in terms of determining who can come back to work. In addition, you may want to consider including an acknowledgement by the employer that they have paid all of the wages that are due, and they've paid out unused vacation or accrued and unused vacation in that letter, at least from the employer side, you know, verifying that that happened. You may want to apprise employees of their ability to collect, not collect, but use COBRA medical benefits during their period of furlough. Some employers have considered paying healthcare premiums for a period of months during the furlough. Some have not, but it's important to apprise your workforce of their COBRA rights. And then to invite questions or concerns about the furlough period, or questions, you know, maybe put in references to the California EDD to provide guidance on unemployment insurance and things like that. So pointing the employees to resources. Hopefully they, oh, go ahead.
There is a case out there that talks about a furlough of in excess of a one work week is a termination. And so you as the employer need to follow all of the protocols and the requirements of a termination for furloughed employees. As Anjuli mentioned, paying out the accrued vacation, providing the unemployment information, giving them the COBRA notice. All of those are triggered by any furlough that is longer than a full week, work week.
Right, and there's also, and Maggie, that's a good point, because there's, and this is a gray area, but the employer's representations made to the employee at the time of furlough are relevant. You know, if the employee is told that you're, you know, he or she will be furloughed for 30 days, that's one thing. But if you're furloughed without a return date, that could be considered a termination. So it, you know, that is an important thing to consider and to track. In terms of when employees, for those employees who are called back, a best practice is to have some sort of work certification for those employees who are returning from furloughs, who are returning from layoffs, or even self-quarantined, where they indicate whether or not they have been diagnosed with COVID-19 or experienced symptoms of COVID-19, or even come into close contact with someone who's had COVID-19 during that period of furlough or absence. This is important because, you know, furloughs and layoffs could span several weeks, you know, or maybe even months at this point. And you want to be able to track these circumstances when employees do return to work. So that's a suggested protocol.
All right, there we go. So diversity and inclusion is an issue that has been arising in a variety of contexts with COVID-19. As I mentioned earlier, it is far more likely to be people of color and women who are in the jobs where they're in the front line essential worker positions. It is also, as people reopen restaurants, far more likely that it's people of color that are the servers and exposed. the employees who are able to work at home remotely, feel safe, are usually more likely to be your Caucasian employees. And so there is that bias. But another thing that I have seen several of already, and I can only imagine that it's going to be an explosion in the long term, is claims of discrimination in the reduction in force and inviting people back. I've seen employers who are acting very quickly to reduce their employee population. They're not necessarily letting everybody go. They may be letting go a half of the population or a quarter of the population. They may be letting go of a particular aspect of the workforce. Normally, when an employee goes through a reduction in force for economic reasons, they do a lot of charting and they plot the ages of the employees that are being let go and the ages of those being retained and the genders and the national origins and the religions and the races. When you are thinking keeping all of these employees on the payroll for the next however long is going to bleed me dry, you just slash and don't necessarily go through that analysis. Again, for employers that have already done this, at least when they start bringing people back, they should look at the balance of people that are coming back. If employers have not done it already, I would encourage them to go back and to try to do this analysis when they are going through the reduction in force so that they don't have a disparate impact on any particular group in their work environment. I still like the very objective standards that you can go by if you are laying off people using things like last hired, first out the door, or based on the performance ratings, as long as there's not some biased manager who's rating people of color or women less favorably in their performance than she is for Caucasian men. So those kinds of things really need to be considered in both the reduction of force and in the inviting people back. For Americans with disabilities claims, disabled people, I think that we're going to be seeing more failure to accommodate, failure to engage in the interactive discussion of accommodation, some from fear of contracting COVID, some from the need to attend to families, and some from I've had COVID and now I've been cleared, or I've been exposed to COVID and now I've been cleared by my doctor to come back to work, but you don't let me, or I am being shunned in the workplace. That would also trigger a potential claim under the Americans with Disabilities Act, because it is a mental or physical disability. Certainly COVID interferes with major life functions, and even exposure, it would fall under the other the other prongs of the Americans with Disabilities Act. You're not actually disabled, but you're being perceived as disabled. And so you're shunned by your coworkers. So when you've got somebody who's had exposure and is coming back to the work environment, I think you need to talk with them, find out how they would like to be welcomed back. Hopefully you haven't necessarily disclosed to people that they were exposed, but they may have disclosed that and not thinking about it, or it may have been obvious to people, even if you didn't say it, that they were out for a couple of weeks as a result of potential exposure. And so talk with them about what they are comfortable being discussed in terms of their being welcome back. Make sure that somebody is there for them to come to if they feel like they're not getting a fair treatment in the work environment, so that they've got an open door and you can work with them if other people are trying to avoid them in the work environment because they've got a history of having been exposed or a history of having COVID. Anything else that you're seeing on ADA or discrimination?
No, I think that's a good summary. we should go into harassment, but I think that's next. I don't want to get ahead of ourselves.
No, I don't think so. Go ahead.
The point here was just to highlight that workplace harassment is still, can still be a concern even in the remote environment. And managers could benefit from training their staff about, appropriate communication over electronic methods like Zoom or teleconferences or video conferences, things like that. So I just wanted to touch upon that because it has been something that's been in the legal news. Harassment is present and can still be present in this setting.
Yeah, the nature of harassment has changed because you're not seeing claims of somebody groping me because you're not face to face. But I think there are two factors leading to it. One is remote communications. We are just not as familiar with it. You don't see the body language. You don't maybe get the nuances of what the person is saying. And people are less comfortable. They feel exposed sometimes having their face on camera. They don't want to be there. And they also are having all of these stressors behind them in their daily life. And so they're reacting differently. A comment that they might have just rolled with becomes highly offensive. And people who are in an isolated environment, they may be living alone, not having a lot of contact with people, and they may have a lot of expectations. This is their social life as well as their work life. And if it's not warm and fuzzy, it becomes harsh because it's not living up to their expectations. So there are a lot of things that you can do, again, to open the communication lines, as Anjuli said. Make sure people are comfortable. Make sure that you are listening to them. Make sure they feel that you're listening to them as part of the discussion. That's one of the things that I have seen in the investigations I'm conducting now is a feeling that I'm alone and not being listened to and not being supported. So we have to, as the managers, need to find different ways to support the employees. A lot of claims of harassment really are claims of poor communication and poor management. And that's true now probably twice as much as it was before the pandemic started, in my experience, sort of ad hoc experience. Thanks for reminding us that we needed to talk about that. And then in the workplace, performance tracking. Super hard to work with a team, super hard to motivate people, super hard to supervise people when you can't just walk down and say, hey, come into my office, let's talk about this. When you have to summon somebody to a 10 o'clock Zoom and you're looking them in the eye over the internet, that has a lot more impact than a casual chat about, hey, this report could have been improved. Even if you use exactly the same language, you are having to record and reflect your documentation of performance in a different way. Emails are fabulous for performance improvement tools, but the manager really needs to be trained on how to write those emails so that they are positive, that the goal when you read the email is improving the performance, not sending somebody down the termination path. People are really afraid now. You've let go of 25% of the workforce and I'm not doing well. That's going to start causing fear in me about, am I the next person to be let go? So offer managers training in how to do that. Make sure that HR's door is open and that HR communicates with the managers about their availability and maybe runs mock sessions with the manager before the manager calls the employee to talk about the performance issues.
Yeah, and also it's important in those discussions between HR and management to look at what is the employer's policy for implementing performance improvement plans. You know, what is the criteria that employees have to meet, and what happens depending on the level of employee, you know, if those criteria are not met. Because as Maggie pointed to, a lot of people who are in situations where their performance is being addressed, they may think they're being set up to be laid off. And while it may be entirely permissible under the law, you've got to make sure it fits in with your policies as well.
And remote working creates many ethical issues, many opportunities for ethical missteps from both the employer and the employee perspective. I want to start by talking about the employer perspective. Gosh, I have to let go some of my workforce. Normally, I wouldn't be letting go of Sam, but she's been a troublesome employee, and I'm just going to hide it in this reduction in force. Yeah, probably not the way to get rid of Sam, but a lot of employers are thinking that. Another employer side is the privilege. What privileges people have and can abuse in their remote work environment. And when they are choosing to outsource work, are they choosing to do that again for the wrong reasons, or is there a particular need to outsource work? And when you are outsourcing work or having people work remotely, are you providing appropriate security for your confidential data? This is huge for employers or for lawyers, because we've got client communications and other data that's out there. Those of us that work in employment law are going to have both client communications, and we may have confidential information about the employee because we're helping the employer slice and dice their workforce or work through what kinds of accommodations might be necessary. So we've got health information, we've got pay information, and we've got client confidential information. And if we're using the wrong software program, we are potentially setting ourselves up for a violation of our own ethical responsibilities as lawyers. Now, from the employee side, there are very creative ways that I have seen for employees to engage in things that are of questionable ethics, I think. I heard, again, some of this is ad hoc, some of this comes from my clients. An employee decided to move, and I've seen lots of statistics that employees are abandoning San Francisco, but the employees are doing it without telling their employers. Okay, I'm going to continue working remotely from Kansas where it's cheaper, or from my parents' home where it's less expensive, and I'll have some family around to support me during this difficult time. They're working in remote locations. Another thing that I'm seeing happen is a lot of questions about the time that's being recorded. The employee doesn't have anyone there to supervise. Are they truly working an 8-hour day, or are they working a 5-hour day and reflecting that they are being active and productive during an entire 8-hour day? I have heard of employees that have just gone on vacation without telling anyone, and they're clocking in and they're really on vacation. So that creates ethical issues, and it also creates issues if they are traveling about what to do with them on the return. They're just not, they may know that the employer is saying, well, if you go to Mexico and come back, you're going to have to quarantine for 14 days before you come back to work. So they don't bother to say that they are going to Mexico and coming back. And I think the remote work environment gives the employee the opportunity to engage in security breaches because they may well have more access to confidential data that was locked up in the company's servers if the company hasn't appropriately set up the remote connections. So the employee is able to download the secret formula of Coke and then sells it to a competitor, or uses that confidential data to begin to set up a competing business. If you've got an employee who's got access to pricing and profit points and the names of contacts of your customers and the customer's needs, you've given them the opportunity to really think about how they could do this better and all of the information they need to communicate to your customers about how they could do it better. And if you've got them on a reduced schedule, they may have the time to start setting that up and make the plans and run off with some of your business, even as reduced as it already is. So those are the things that I see as potential ethical issues, but I know that there are people out there that are way more creative than I am that are going to come up with some other stuff. Have you seen anything interesting, Anjuli?
Well, I think, you know, I have seen some of the things that you've discussed, and I think that one of the overarching principles here is, you know, staying in touch with your workforce, engaging your workforce in this remote environment. And that can be difficult to do. It's time consuming, and managers, you know, supervisors themselves have better things to do per se than just have check-ins. Especially for those of us who bill, it can be, we're discouraged to do that. But it's important, you know, it's important to stay in touch and to keep track of where people are, what they're doing, engage them. If you can't engage them in a particular client-related or billable work or, you know, type assignment, you know, find something for them to do that's productive and in furtherance of business goals to keep them engaged. Because that, I think, prevents a lot of these issues, the ideas, from starting and being implemented. That's my take on that issue. You know, I've heard a lot of companies have virtual coffee breaks and things like that. And that's just one example of an effective tool to keep people in the loop.
I was actually
and out of trouble.
Whether you thought virtual coffee breaks were a good use of time.
So speaking of breaks, it's almost 11:30 and we have some questions in the chat and one question in the Q&A. So if you think appropriate, now may be a time to get to those questions.
That sounds great.
Sure.
Oh, I guess he's leaving us to read them.
Oh, I'll read them. That'd be my pleasure. Okay. So besides Marta saying, "Morning, darling," we'll go to Chris Mead's question. Wasn't sure about question protocol. Okay. Actually had a mask question. State mask guidance requires masks in public areas and internal areas where social distance cannot be maintained. What do you think about meetings in internal conference rooms that are not public places where clients maintain that social distance can be maintained? I'm concerned that moving around internal spaces can't necessarily be controlled also. What about air circulation? Acceptable risks or masks recommended?
So, yeah, good questions. Taking into account CDC guidance and California Department of Health guidance, the protocol suggests that individuals in the workplace should wear masks when they're in an environment where they're going to be in contact with people. So that's beyond just where social distancing is not possible. The scientific risk of being in a room where air is circulated from another space. I don't think that's been determined by any health agency, but to prevent against that, face masks are encouraged. Now, they're not mandated, but they're encouraged. Some states, and actually, if you have questions on any states outside of California, I have a state-by-state chart that I've put together on this, so please contact me instead of digging up the guidance on your own. But some states have issued guidance particular to face mask requirements in the workplace, and they've got specific protocols when face masks are and are not required. So that, California is not there yet, but it might be. I have been in depositions, like an in-person deposition in a conference room where we wore gloves and we wore face masks. The deponent did not have her face mask on, but that was a voluntary choice. So I think the short answer is that protocols are being developed. Each state and each county is doing that at a different pace and at a different level of specificity. So, I mean, that's really the best answer that we can give right now is, follow the CDC guidance and California State Department of Health guidance, which is pretty detailed and available online. I think one of the issues that comes up is, well, what happens if someone refuses to wear a mask? What can and can't you do?
And I think that you can adopt internal, more protective requirements than the CDC guidance. There are already some decisions, regulations saying that businesses can turn away potential customers for refusing to wear face masks. And remember, the initial guidance about face masks was that my face mask protects you and your face mask protects me. And so if you have employees who are concerned about coronavirus transmission in the workplace, I would urge you to be more protective and to require face masks for everyone in the work environment, unless they are in a private office where they are not likely to be interrupted. So even a 12-foot, 25-foot conference room with only 2 people in it, somebody's going to get up and walk around and pace, and somebody's going to get nervous about it. Certainly, if you are running a production line, or you're running a preschool where you're chasing after toddlers, you're going to be entering other people's space without thinking about it. And so I encourage people to have higher standards than the minimum for the comfort of the people that are afraid. The other thing that I am seeing across the board is that people are becoming more relaxed about their social distancing, forgetting about it. When the pandemic first started, just at the grocery stores, you would see people standing in line and honoring the little dots that they put on the floor and honoring the One Direction signs in the grocery store. And people aren't doing that anymore. And people are in part comfortable because they have the face masks on. In part, they're just tired of doing it. In part, they're forgetting about it. They're not as hypersensitive. So having the face mask does give you protections, and it also gives you a reminder of all of the other things that are supposed to occur in the workplace, like social distancing, because you look up and you see somebody with their face mask dangling off their face or even on their face, and you go, oh yeah, shouldn't be as close to them as I am right now. So I think it's a good thing to mandate, but it's probably not legally mandated.
So,
not yet.
Marta has a question. Going back to when you talked about reductions in force and possibly doing it in terms of employee rating, Marta asks, how about rating an employee lower on performance for, quote, too many absences from the office makes it hard for them to keep up with their work or be an active participant. Where do you think that falls in or out of what's acceptable?
So it depends, right? It depends, if those absences are protected, right? That's a relevant factor.
Yeah. If their absence is related to their own health care, protective factor. If their absence is related to caring for an ill family member, it's probably protected. And so there are plenty of ways that you can get into trouble by acting on those absences. If their absences are related to active drug use or active alcoholism, probably not protected. The same kinds of concerns that you would have in a non-COVID environment are the concerns you want to look at in the COVID environment.
And, we're seeing in the news, at least I'm seeing in the news, the idea of motherhood bias during COVID-19, and that's a developing area. Not a protected characteristic per se, but, if everyone on the warn layoff list is a working mother, that's going to, that's going to look a certain way and could expose the employer to risk. So, it's important that any decisions that are being made are done so on a non-discriminatory basis. But your question is whether just putting someone on the list because of absences, well, there may be a very legitimate reason to do so. It depends. You have to look deeper and say, well, what were the reasons that they were absent, and are those protected or are they not protected, like Maggie just said?
And you may not be able to go back to the same kind of standards in evaluating whether it's a protected leave of absence, because you may not get a doctor's note for someone who's been exposed to COVID. The doctors don't want to see them necessarily. And some of the leave requirements say you cannot ask for a doctor's note for COVID
right.
exposure or even for a COVID diagnosis. So you can't just say, well, you didn't give me a doctor's note and I asked for it. You're going to have to accept the employee's report.
Representation, yeah.
So another question, this one in the Q&A from David Marciano. I believe Maggie stated earlier that ADA protects workers who express fear of returning to workplace and getting exposed to COVID. If so, what is the case or authority supporting this?
If I said that, then I overstated it. What I've said is people are making claims that it does. I have not seen a case or authority supporting it. I think that a fear could be a mental disability if it affects their ability to function, to carry out a major life function. I think that you would need a diagnosis of that. But if they have other underlying characteristics that already constitute a disability, that may make the fear more reasonable. I think we're going to see a litigation around that, but I don't think there is yet a case or guidance other than the Department of Labor, Federal Department of Labor guidance saying, please be lenient and flexible to the maximum extent possible.
Which leads into another question from Chris, wondering if you're seeing pandemic claims yet. Most of my work has been counseling employers on leaves, telework policies, application of FFCRA. I'm not seeing a lot of claims from furloughed or laid off employees yet.
I have not seen claims either, but lots of Q&A with clients about, how to respond to employee inquiries, why am I being placed on leave, or what benefits do I have, things like that. But, it's still early on.
I am seeing claims.
In the process.
No,
okay, good to know. What type of claims?
I've seen claims that the employer laid off a disproportionate number of fill in the blank, returned to work a disproportionate number of fill in the blank, I've seen claims that by raising questions about my rights during COVID, I was fired. And so it's, I have a pre-existing health condition, and so it's disability discrimination because you didn't like me asking questions about my right to time off. So I am seeing some of those already.
Yeah,
They're not yet in litigation, they're in pre-litigation stages.
I've been getting a bunch of inquiries along those lines, the retaliation claims and other claims concerning time off and layoffs. So they're going to come down the pike.
Absolutely.
Okay. Chris says, aha, new retaliation theories. Exactly.
There are always creative, always.
We employee side lawyers have to keep you defense side lawyers actively engaged and in practice. Anything further? Okay.
Do we have any more questions?
How much information would you say an employer can ask for contact tracing purposes and FFCRA leave purposes without jeopardizing employee privacy? And I would add to that, how much information can an employer then share with other employees to put them on notice of potential COVID-19 exposure?
So I think the threshold there is that you can collect as much information as needed to determine if the employee poses a threat to others. Now, I may not have parsed that out, exactly, but that is my understanding as to what the threshold is. So temperature testing, do you have any of the common symptoms? Have you traveled to any, states or countries that are considered to be high risk, meaning that there are more than 5% of cases within a certain time frame? Those seem to be all legitimate questions based on, to make a determination, is this individual going to be a threat to other employees in the workplace or not?
I think you can ask if a family member or someone in their immediate household is positive, and require that they get tested before they come back to the work environment if they are living with someone who is positive, or know that they have an extended exposure to someone who is positive. Interesting question came across my desk the other day. The employee's sister, not someone they live with, but someone they'd been partying with, was diagnosed as positive. And what could the employer do? What could the employee do? The employee was willing to remain at home until they had a negative COVID test. And so that part was easily resolved. The question about what you can tell other employees, I don't think you can say, well, it's Joanna that has COVID. But if you have had an active or potentially active exposure in the work environment, I think you owe it to your employees to say, we highly recommend that you get tested because there's been an exposure, but you can't tell them who it is. It may be that they're going to figure it out because Joanna's gone for 2 weeks, or they.
So Maggie, is the employee who's at home awaiting test results paid for that time?
I put them on I do put them on FFCRA leave and pay them through that if they are entitled to that. And if they're not, I would treat them use regular sick leave or FMLA time off.
And if all of that is exhausted or doesn't apply, the protocol or the best practice would be to pay them, right?
I think
if they've exhausted all of their leave, if the employer is directing that they stay at home while awaiting a result.
And they can't do any remote work, yes. I mean,
yeah, that's what I mean. We're talking about grocery store workers, healthcare workers.
Yeah, I would prefer to see them paid. There are some employers, that are just in really dire financial straits and they're saying, I can't do that. I can't pay people who are not productive. I can barely pay the people that are flipping burgers so that I can get them out the door.
So if we don't have, before we end, even if we have a few questions, I just wanted to touch upon two quick other areas that employers should be thinking about. One of them is employee benefits and executive compensation, making sure that employers are keeping up with COBRA compliance with respect to medical benefits. I just wanted to quickly highlight that there's been recent regulations, I guess it was issued in April, so not so recent, tolling the timing rules for COBRA with respect to providing notice, electing coverage, and paying required premiums. So employers should continue to provide COBRA notices in accordance with past practices, but just be attuned to these particular regulations about tolling the timing rule. It's also important to make sure that employee benefit plans are kept in compliance with ERISA for those employees that are either on furlough or are on are being laid off. And also important to keep up with immigration and look at regulations pertaining to your workforce that may be on visas. I just wanted to bring up those two areas just to make sure that we talked about those as well.
Okay, any other questions? So then
Be good
this
to go.
this is it. This ends this informative and useful and timely seminar, but also highlights the need for another seminar on training in the workplace and how to train employers to treat their employees appropriately in the age of COVID-19. So you all can look forward to that from the labor and employment section. Okay.
Thank you all very much. Anjuli, Maggie, David, thanks so much. And we look forward to more from the employment section. Have a great day, everybody.
Thank you.
You're going to get plenty.